Good morning to everybody out there. Welcome to our next installment of Coach's Corner. We have been very thankful to partner with the IHSAA to provide just a platform where we as medical providers can get together with a group of athletic trainers and coaches and even administrators to share information and to learn from everybody. We've had a lot of fun doing this, and I hope these are topics that we can improve day-to-day care of athletes to keep them happier and healthier. I'm really excited for today's webinar. We have Dr. Michael Bender, who is going to talk to us about injury prevention in throwing athletes. He is a orthopedic surgeon and specializes in shoulder and elbow care. So this is right in his, you know, highway of what he does and loves to talk about. He takes care of Butler athletics, which I think has been enjoyable and time consuming at the same time. But without further ado, I'll hand it over to Dr. Bender, and he's going to give us a little presentation, and then obviously we'll talk about this a little bit more. And don't forget to use the chat function. As questions and comments come up, please use the chat function, and I will monitor that throughout this webinar. Thanks.
All right. Well, thank you, Scott, for introduction and stuff there. And thanks to all you guys for participating. We're excited to talk about this and just kind of share. We learn from all of each other and how to take care of these athletes even better. So again, we're going to talk about injury prevention in throwing athletes. Scott mentioned a little bit of my background. Again, I do just shoulder and elbow surgery. So our talk is really going to focus on the upper extremity component of the throwing athlete. A lot of my training was in Houston, where we worked with the Astros team docs there. We're actually fortunate enough to win the World Series while we were there. Found out later we may have cheated to win the World Series while I was there, but I had no part in banging any trash cans, at least. So as he mentioned, I have other roles in athletics as far as working for Butler's head team doc, part Tudor High School, shoulder care for Indiana State, and we actually started working with the Indiana Bulls to help partnership with them. So a lot of baseball experience with that I really enjoy. So we're getting into this as far as why is this a problem? Why is it something we care about? So fortunately, baseball and softball are still extremely popular here in the U.S., with estimated about 15 million that are playing this in youth sports. And many of these, like my own kids pictured here, want to get to the next level as far as in college and maybe even become the 750 exclusive in the major leagues. So in order to do that, they want to play and play a lot. So in order to get to the level of these professional pitchers and want to do that, they throw a baseball over and over again for as hard as their body can do it. And this requires an extremely coordinated efforts and explosive movement that really involves your whole kinetic chain, but it really puts a ton of stress on the body. A lot of times these high velocity pitches get really close to the max of what the ligaments can withstand in order to throw the ball this way. So it's not surprising that doing this year after year can lead to sometimes CNS. So we're not going to delve into too much, but there's a litany of different shoulder injuries that can happen from this, whether stress-related injuries to growth plates, injuries to the tendons, the labrum, as this video shows, like a bucket handle tear of the labrum that had to be fixed. But the good news is that for most shoulder injuries, the majority of those don't require surgery. And fortunately, we've gotten less and less aggressive at fixing shoulder injuries related to throwing, because we usually can get most of them back with rehab. However, elbow injuries have actually still been on the incline as people play more and throw harder. And these often do sometimes need surgery much more commonly, whether it be stress-related injuries or more so the surgery related to ulnar collateral ligament injuries, and Tommy John surgery and things like that. So we really want to figure out how to prevent these. So in order to do that, we really have to know both what the risks are as far as what caused them, and then figure out which one of these are preventable. Sometimes they're easy to prevent. Sometimes we don't know how to prevent them. And there are a lot of good resources online that people can use, whether it's pitch counts or just understanding for parents what risks are. And we know we're not trying to bubble wrap our kids like this picture shows. We know there's always going to be some risk in sport, but we want to figure out what we can do to make it as fun and enjoyable and successful for them, while still trying to, again, minimize this risk. So we'll kind of go through a list of some of these potential risks and kind of figure out which ones we think there's actually evidence that it is a big risk and which ones maybe aren't so much. So the first one on the list is overuse. So this one is a definite yes. Honestly, this is the biggest reason we see throwing related injuries. It's just the repetition and overuse, whether it be the big push with year-round baseball, which has become a really big thing, and the pressure for kids to play in these travel leagues and extra training all year round, whether it be too many months of the year, too many innings, pitch counts because they're on multiple teams and other coaches don't know how much they've already been pitching, or again, different positions that they're playing. So a lot of the rest of these will all kind of correlate with this, and we'll see a theme. And then maybe a little side conversation with this is the idea of this early sport specialization. So it's been a much bigger theme here, is that kids need to pick a sport and do it year round at a very young age, as opposed to playing multiple sports. So it's interesting, actually, in Major League Baseball, they've even looked at this and said that their athletes that played multiple sports compared to a single sport actually had more games they played, a longer career. They had fewer upper extremity injuries and less time in the injury list. So they were actually healthier and had a longer career. And there's even other studies showing their performance in even other sports like Olympic events and other things are often better in those that were more diverse in their sports. And those in the major leagues, again, over half of them here did not ever specialize and just play one sport. And those that did, it wasn't usually until average 14. So we don't really feel like we need to push these kids into that as aggressively as maybe they felt. So number 2 on this list is fatigue. So this one is another big definite yes. So, and by fatigue, some of that can show up in different ways, especially those that are pitching while fatigued. Those that did it on a regular basis can have up to 36 times injury risk when they're throwing or pitching with fatigue, whether it's in their forearm is probably one of the biggest things, whether it be changing their mechanics from fatigue, or especially in their forearm. If they have weakness or an injury that may be minor in their forearm, that those muscles really help offload the ligaments in their elbow. And when those muscles aren't helping, then the ligament sees all the stress, and that's one of the biggest risks that people get for tears and need to see us for surgery often. So other things are just that lead to this as acute spikes in the workload, whether someone either coming back from injury that jumps straight back into normal workload without transitioning. That's why we're often doing throwing progressions and things like that to kind of help gradually increase the stress and help them just from having a worse injury from acute spike. So curveballs. Now this one is probably been ingrained in a lot of people in baseball for a long time that hey, you shouldn't do curveballs until puberty. So the question, if you actually look at the data, you actually say unlikely. So there's actually less stress on the shoulder and elbow when throwing a curveball than there is a fastball. So there's really not good evidence to say you shouldn't do it. Now, there are studies showing that maybe some increased soreness in those that do curveballs and sliders at a young age, but hasn't really shown injury risk. However, there is still a common thought that they need physical maturity to be able to do this well. So whether that's their core strength, have good neuromuscular control, and have good instruction on how to do that. So it's interesting. A lot of times we'll have these kids in our office, and again, we expect them to have good mechanics and repeatable ones, but we do tests where they try to like squat on one leg. It's kind of what's depicted here, and kids can't have any balance. They're wiggling all over. They're falling when they try to do this, and to expect them to be able to stand and push off of one leg and have repeated mechanics is just kind of a big challenge. So there's still, again, no proof for curveballs, but it's still more of a consensus opinion that recommending more fastballs and changeups until their body is ready for that, but no real proof that it's a big risk. So now velocity. Now this is one where again, everyone wants to throw harder and do that, but is that a risk? And unfortunately, it is yes. So I think some of it makes intuitive sense that the harder you throw, the more stress you're putting on the body. Now we want a lot of that velocity gains to be from your lower half, from your body, and how your trunk and core translates that, and just be more efficient in how you throw. But that is still one of the biggest risks for major league players to need UCL reconstruction is just having a high velocity. So I mean, there's so many baseball players in major leagues that can throw 100 miles an hour now that it seems like everyone does. And this guy here is depicted as actually Ben Joyce. Now, he just got drafted out of Tennessee this past year, but last year at Tennessee, he even threw I think 105.5 miles an hour. So um, again, the velocity is going up. The question is it modifiable? No one really wants to say, hey, I want to throw slower, but I think it's more about how you get the velocity and what lengths you go to as far as how you put stress on your body. As even Ben Joyce in here has already had Tommy John surgery before this, so you can see that that is just a big risk yet. So radar gun use. Now, this is one where there aren't as many studies on, but it is thought to still be a risk factor. This is probably more important at the young levels, just because it's not encouraging, again, as good mechanics and how they throw, but it really encourages too many max effort throws and trying to pushing the limit of what their body can do and them trying to kind of push the limits of that. So while there's not as many studies proven, it is thought to be a risk factor. Showcases. Now, this has become a lot bigger thing because these athletes try to play baseball year round, or again, they want to be seen by coaches and recruits. So they have these events where they can get seen and recruited. One of the temptations, though, is to maybe do things that are out of their normal routine, and there have been studies that show that this may increase their injury risk. So whether they're in the middle of football season and they all of a sudden say, hey, they're going to go and pitch and maybe throw harder than they should because the radar guns are on, you got people watching, their arm may, again, not being in peak condition, or again, they're just having a lot increased volume in a short weekend, has been shown to increase some of their risks, especially those that do a lot of these showcases. So I think at least having to do these with caution. Again, maybe not as big of a risk for hitting and field position players, but for pitchers especially. Positions. This is one that's come up from time to time, and again, maybe a few mixed studies, but there have been several that have shown that yes, that having certain position combinations do increase the risk. So the biggest one that comes up is a pitcher and catcher combination. So when you have these kids that are pitching, and if the catchers probably throw the second most and throw in the hardest right after them. And if their rest and recovery time, they're catching and they're really having a very high volume of throws, it often doesn't lead to appropriate recovery time. And then they are often pitching with fatigue, as I mentioned before, and can be higher risk of injury. So this is one where I think it's at least wise as far as for parents to be aware of, and even coaches for how they position their athletes to set them up for success. So mechanics. For this one, we probably say is likely. It's a little harder to define, though, as there's not really any one set of perfect mechanics. We have gotten a lot more sophisticated and with biometric analysis and different motion sensors that can help us define what really puts more stress on different parts of the body. But this is where we still are a lot more reliant also just on pitching coaches. We have some therapists that are kind of specialized in baseball stuff that help us with the big picture things, but to kind of help us with. But we do think this matters. We see it a lot when people are coming back from lower body injuries. If they've had an ACL injury, if they've had a hip injury, that affects maybe their stride length. It may affect their hip shoulder separation, just their mechanics. Then how that force gets transferred to their shoulder. They have been people coming back early when those are abnormal, increase their risk of having an injury in their shoulder and elbow. So that's one thing that I think needs to be evaluated. It's probably harder for us in the office to evaluate, but where we really depend on the pitching coaches and trainers and stuff to help us with outside of this. So this is probably the most controversial one. So I'll probably spend a little bit more time on this, but the idea of weighted balls. So this has become a lot more popular. For those who aren't as familiar, it's having different weights and sizes of a baseball in order to, the goal was to hopefully increase the strength and thereby improve their velocity. So the thought being like, hey, if we're using a heavier ball, just like you see guys use a heavier bat to warm up beforehand, that it would maybe increase strength and velocity. So is this a risk? The answer is maybe, and probably more likely. But to start out, I would say there's nothing magical about a 5-ounce ball that really makes it safer than 4-ounce or 6-ounce. So A baseball isn't way safer than throwing a football, but I think they still have to be used in a smart way. So there have been shown proof that it can increase velocity, but a lot of it comes not as much from strength, but actually more from increasing the shoulder rotation. So you guys see a lot of baseball players when they're throwing, you see how far back their arm can rotate. And there are very specific evidence that increased external rotation leads to increased velocity. So we think that's really where it comes from. But there is a lot of concern that this increases injury risk. Now, I think personally, I think a big part of it is much more, it needs to be considered as part of the workload in general. So often these athletes are doing this more in their off season. So they may have actually done spring season, played summer ball, fall ball, and then maybe during the time their arm should be recovering, they're doing these high level max intent throws, trying to improve their velocity, and they never had a time for rest that ends up catching up to them. So there's different theories in that, maybe how this can be used and still reduce injury risk, but there is some thought that's a risk. So again, I tried to bore you guys with many studies. This is the only one I kind of mention in here, just because this is what kind of triggered all of this. So this is a study where Dr. Andrews in Birmingham, they had two groups. 6 weeks, they did half of them with weighted balls and half of them with no weighted balls, and then compared them before and after. Both groups actually gained in velocity, but the weighted balls had 80% increased their velocity by about 3%, compared to 67% in the regular group. So about 13% improved where they wouldn't have otherwise. But it was actually interesting, their shoulders actually didn't get stronger. It was actually the opposite. The other group actually shoulders got stronger. The only thing they really noticed is that increased rotation of their arm is what they thought led to the velocity gains. So, but one of the big points is not just the velocity. The study group with the weighted balls, there was 24% of them had an injury to their elbow, either while they're doing the study or in that following season, and maybe it kind of caught up to them. So that's where we became a little bit more heightened and aware of that. So they actually even did a survey of a lot of high-level athletes, that college and professional, and about 75% of them actually thought weighted balls improved them or made them better as an athlete. But 75% also thought it had injury risk, and about 20% thought they already had an injury that they attribute to weighted balls. So it comes at a risk, but some of the athletes still thought that risk may be worth it. So it's something I think we can refine and hopefully make better here. And the last thing we kind of mentioned is maybe this nutrition, and potentially vitamin D as a part of that. Now, I think there's already another talk that's probably much more sophisticated and in-depth on nutrition, and that's not my area of specialty, but I think this is an area that we can still improve on. But vitamin D in specific is one that I think is one of the low-hanging fruit that I think may be something we can do. The rate of people worldwide that are deficient in it is about 1 billion. So it's a huge percentage of the population. Now, we get a lot of vitamin D from the sun. So in areas where there's not as much sun, they may not get as much, but even places there's extremely high rates of deficiency in that worldwide. So that is one known factor that increases risk of things like stress fractures. So especially kids that get stress fractures of like their growth plates, called like little leaguer's elbow or little leaguer's shoulder, are pretty common to check that. And the rate of them that are deficient in it is extremely high. For me, it's been about 50 to 75% are. So there's not a lot of proof that can prevent it, but it is a pretty simple and straightforward thing that if we're treating it, that maybe we can prevent some of these. So that's to be determined a little bit. So I'm just going to go back, maybe summarize a few of the high level thoughts as far as the recommendations. I think big picture is the parents and athlete, and especially the coaches and trainers, really need to be proactive about monitoring workload more than anything. So especially the parents and athletes when they're on multiple teams where no one can keep track of exactly how many throws they've done with each team or how much they're throwing on their own with dad at home and things outside of that, to kind of be aware of that. I think having time off in the off season to not be throwing maximal intent and max velocity throws is necessary. They can still train, get stronger, develop other parts of their game, but need time off from that for their arm to recover. Other things is not pitching, especially when fatigued, or throwing, especially through elbow pain. I think that's the one that's more likely to lead to further injury and possibly surgery for them. I do encourage multiple sports. I really, if at all possible, don't want kids to specialize early on. I know there's a lot of pressure on these kids to do that, and think that they're going to fall behind, but there's a lot of evidence that it may increase their risk. But multiple sports can actually be good for their performance. It develops other parts of their athleticism, and I think actually can make them better as an athlete in the long run. Again, radar guns and showcases aren't bad on their own, but I would limit these and just be smart about how you use them for the young kids, especially. Pitchers, again, I would just be cautious about what their secondary positions are so they get adequate recovery time. Weighted balls, I think, can be used, but we have to figure out how to best use them as a part of their overall workload and how to reduce at least the injury risk to maybe get gains. And then again, I think in the future we can figure out how nutrition stuff may kind of benefit us a little better. So that's kind of the big picture as far as kind of what my thoughts are, and I'm really kind of open to questions and what you guys have that we can help with.
Thanks, Michael. I think that was a great summary of a lot of the things that we think about for throwing athletes. Fatigue-wise, I just threw like 400 balls at Little League practice last night. Batting cage beforehand. It's coach pitch in the league. I got a dead arm today. What should my recovery process look like? If you had to, tell a coach or athletic trainer for a high school pitcher, what would you describe to them as the ideal recovery period?
Yeah, that's a good question, and that's where I think a lot of the athletic trainers and pitching coaches and stuff have got a lot better at, as far as there's probably more routine arm care that's done, as far as what that looks like, as far as mobility stuff, when they're what to do as far as strengthening, rest time, when you do pitch in between, versus when you get kind of pushed beyond that. If you've thrown 400 balls, you may not have a routine rest period of time, and you may need something a little bit more prolonged. But yeah, there are a lot of defined arm care programs as far as that goes, as far as between keeping your rotator cuff strong, things like that. But when to have some lower intensity throws to kind of keep mobility in that, but also then as far as when to do, again, to limit you still have some bullpen sessions usually in there afterwards, but you have to be a little bit more careful about how many max intent throws you're doing and minimize those in between. So I think there's two differences with that between routine arm care and then when you get pushed beyond that, as kind of you mentioned.
Yeah. And, part of that routine maintenance program, it's more than just cuff strengthening and icing the shoulder down and rest. I mean, I know the people that I see, the athletes that I see, we end up seeing a lot of scapular dysfunction, right? We see a lot of core weakness, hip weakness. And we've talked about this before in this platform, which is the idea of the kinetic chain, right? And you brought that up in one of the slides, in that, for young developing athletes, having a good kinetic chain where they understand how to move their body, they understand, hey, we've got to have good hip and core strength, and that's how they produce the power and velocity. And it's not just how strong is my arm.
Yeah. No, I think it's a good point, and I think it's underappreciated. And a lot of those things, like you mentioned, that kids may not realize or parents may not realize until you almost point out some of those deficiencies. Whether, like I mentioned, if you really when you really examine these guys the first time, it can take a long time, because there's so many of those things that we're looking for. We're not just examining their arm and their shoulder, but again, I'll have them do a single leg squat. We'll try to measure some of these other things, but which can take a while. Or we also involved some of our therapists that have a specialty in this, to kind of put them through a long 30, 45 minutes, sometimes an hour like session of kind of detecting these deficiencies to work on. But it is some things that scapular things you can't often see until people are in a mirror, or you're kind of pointing out things to the parents while you're examining them, and a lot of those other deficiencies. But I do think it has to be pointed out, like, especially they want velocity gains, they want to make improvement in their performance. Those are the areas that you can probably really make gains without increasing their injury risk as much. Um, and I think that's really what they have to kind of emphasize to them a lot.
Two follow-up questions on that.
Sure.
Should every pitcher have an evaluation of their technique, form, velocity? I mean, should that be a routine thing for every high school pitcher, or is that only something that we should do when somebody has a problem?
Oh, it's a good question. We actually did this a little bit, as I mentioned. We're kind of a relationship with the Indiana Bulls. We're kind of helping with, and we actually are doing some of that. Actually, for like a lot of them, not for the coaches and the ones that have wanted to have interest. We're kind of started the process of doing that in injury screenings and detecting at least some of the big picture things. You detect a big deficiency in something that can be something you can address. So I do think there's a place for that. I think when you get into just mechanics of it, I think that gets a little bit harder, because a lot of people can throw from different arm slots. There's not one perfect mechanics. So I think there are some, again, defined metrics that I think maybe should be evaluated. But to say, hey, no, everyone needs to throw from the same arm slot or things like that, I think it's kind of a slippery slope. So again, I think some degree of screening for that, especially if they get higher levels, is a good idea, or just having good instruction as they're going along. But yeah, we're kind of delving into that though with this to kind of figure out how many deficiencies we find, and then trying to track, does this make a difference, and have we actually prevented injuries from happening? So we're trying to figure that out, honestly.
Okay. I think a question I always try to ask our guest that we have on is to provide some advice for the athletic training team or coaches of athletes that, maybe they have a little bit of soreness, maybe they have a little bit of pain. When is the time to say, look, we need to shut you down, or we should send you to Dr. Bender, and we should just make sure everything's okay with your shoulder, right? You
Yeah.
can't do that for everybody that says has a little soreness, but when do you draw the line?
Yeah.
Or
That's a
or
good
a
question.
better way to phrase that would be, when would you be frustrated with a trainer for
For not
letting an
sending someone.
athlete get through something too long?
Yeah. No, and that's a hard thing for trainers, because I know they've heard it both sides. So I know you feel like you probably can't sometimes make the docs happy one way or the other if you send everyone with every first sign of soreness versus the extreme. So I think it's a little bit different in regards to shoulder versus the elbow a little bit. It's probably a little bit more common to get some shoulder soreness and some things like that you may have from time to time. Some of it has to do with, for me, as far as if they get soreness, when do they hurt? Does it hurt actually when they're throwing? Are they sore afterwards? Or and sometimes how long it lasts. If it lasts for a long time, much more than normal recovery, especially if it's 24 hours or more afterwards, that's kind of a red flag to me. If they are getting changes in their velocity, their control, things like that, where something just seems really off, that's something that I kind of say, hey, there may be more going on. For the elbow, it's probably a little bit more defined in that if they actually have elbow pain, that's one thing that we really don't want them throwing through elbow pain. If it hurts when I throw, that's something that is a red flag to me, because it may only be a forearm strain of the muscles, that then next thing you know, like, hey, now my velocity changed. Now I started getting numbness and tingling down my fingers, which is usually a sign that people may have some degree of instability where they're kind of stretching the nerve, and may actually have some deficiency of their ligament. So the elbow is probably the biggest one. If they're having, again, if they're having velocity and control changes, if they're getting numbness and tingling in their fingers, or just have pain every time they throw, that's something that we want to know about, because you can sometimes catch it when it's a forearm issue or maybe a sprain of their ligament before they develop a tear, and you may be able to stop that from progressing. So hope that kind of answered your question. But.
Yeah, no, I think that's perfect. We talked a lot about baseball, softball, overhead throwers. Uh, I think it's important to realize that there are other athletes that are also overhead
Mhm.
athletes in a very similar motion that are repetitive, such as tennis, volleyball hitters, um, you know, badminton
Yeah,
players,
javelin,
uh, i-
football.
javelin, right? So some of those other sports can be grouped into this, and we should have a similar consideration for all of them.
Yeah, no, I would agree with that. It's unfortunately baseball is probably because it's more popular is probably the one the most of studies go, but we do have to kind of take the information from that and try to extrapolate that into some of these other sports and say, hey, this is the best evidence we have for what we should do in those sports. But a lot of the workload and the other things, I think can and should be applied to them.
Yeah. I mean, these pickleball players are going crazy. All these overheads. You got to
They
watch
are.
it.
They fill up our clinic, unfortunately, too much.
Um, and I thought you want Tommy John surgery.
Yeah,
If
that's
I'm gonna be a professional pitcher, don't I want that
yeah.
surgery?
There definitely was a period where there's some misconception that patients actually would come in trying to want Tommy John surgery before they tore it, thinking that would actually improve their performance or their velocity. And there's really not truth to that. There's some have come back and occasionally been higher velocity, but that is not a good reason and is not really true. So the return rate is about 90% in most studies as far as from Tommy John. Some of those at the same performance, some at even a lesser performance though. So that's um, you would hope people can get back to the equal level. The only reason we sometimes see people come back graduate a higher level too is because they were younger and just still finished maturing and growing in their career from high school into college and things like that. So uh, that's not a good reason to have Tommy John surgery.
Um, uh, where would you put the sensation or feeling of having a dead arm, right? I remember playing Little League, high school, multiple travel teams. Um, I didn't even pitch, right? Playing shortstop and third base. Um, and sometimes you'd get a dead arm feeling where you just didn't want to throw. Do you feel like that's a dangerous thing? Is that more of a preparation for throwing? Or where would you put that as a red flag? Hey, we should shut it down and evaluate this.
Yeah, no, it's a good question because I think there's a lot of things that kind of get lumped into that. And we used to use that term all the time just because we didn't have more sophisticated MRIs or evaluations to detect what is truly going on inside the shoulder. So we just lump everything into he's got a dead arm. Um, so, I mean, it can be anything from a nerve or vascular disorder to a rotator cuff injury or strain, some degree of instability component. There's a lot of things that get lumped into that. Um, I do think that it can happen more frequently when people have mentioned maybe like a rapid increase in their workload, those big spikes where they come back quick, or overexert in effort and so forth. So when should it be evaluated? Is I think it depends on how long it lasts. I don't think kids should pitch through that and stuff if they have that. If and be a lot of time for recovery. There may be some positions in the field where if you have sort of like playing first base or DHing or some other positions where I think being smart as a coach or and trainer may help. It's like until they get recover. Because you do get some idea just with time as far as like, hey, if this recovers in 24, 48 hours, it's usually less likely to be a significant thing. So, um, but there's a lot of things that go into that, so it makes it hard to make blanket statements on like, hey, this for sure is something you shouldn't play through or so forth. But I think not pitching through that is probably one of the biggest things.
Yeah. Uh, Specific question from the audience. What do you recommend for non-pitchers that report moderate to severe elbow pain in the first few weeks of a season, and they didn't participate in any activity in the off season? I think this is similar to maybe what we had talked about with elbow pain, but I'll let you take a crack at that.
Yeah. It's a good question. For me, for what it is, may depend a little on the age. Um, like 13-year-olds right in that age is probably the biggest age as they're going through rapid growth. and their growth plates are extremely susceptible to changes in stress and workload. So they get little leaguer's shoulder, little leaguer's elbow. So that's one where it sometimes does require x-rays to prove a change, or their exam to be able to tell for sure. But I just have a high risk of suspicion in that age that they sometimes do need a period of shutdown and then a much more gradual increase in those stresses for the growth plate to not be affected. So I do think, again, there's a lot of things doing like on-ramping or how you kind of gradually build up. So I think, especially probably in that age range more than anything, being very gradual, how they build up their volume and how the body can respond to those stresses, I think is important. But if they get it, I do think probably having to back off on their volume and throwing is probably is the biggest thing. If that doesn't change with decreasing how often they throw, how much they throw, and their workload, and it persists, then probably getting evaluated to make sure if it's truly a growth plate, or again, if they're older, you worry more about the muscles or a ligament sprain. But I would probably just, do that, adjust volume and give it a brief period of rest first. If it doesn't respond, then get evaluated as far as if it's something that needs further attention or not.
Perfect. We've talked about this in the past a little bit. MLB.com is a reasonable resource to look at pitch counts for certain age groups and expectations for throwing. Do you have any good resources for teams and coaches to provide arm care or shoulder care?
It's a good question. I have said, I know there are websites out there that I'm sure you can get some differing versions of that. Again, I do use a lot of times like the MLB that has like the Pitch Smart, which does have, I believe, some recommendations on that, but it's more about the injury risk prevention. And then the National Council for Youth Sports is one that has some things as far as injury risk. We're kind of blessed a little bit here that we have some of our therapists that have special interest in that. So I've kind of probably a little deferred to them a little bit more on helping instruct the athletes in that, because they're more of an expert on it than I am. I don't have one specific website, but it's a good reminder I probably should, to help direct people who aren't able to access that. So there are a lot of good resources out there on that patients and families can find. But I don't have here's one specific for arm care itself.
Yeah, we'll look into that a little bit more. Maybe we can just have a resource available for anybody that follows up on that that might be interested. Well, that's great. You answered all my questions for sure. I think I'm gonna be a better coach and pitcher to my little leaguers when I get back to things this weekend. So do you pitch to your kids?
My kids have not been as interested in baseball yet. So you saw their only season there, which was we're trying to encourage them, see if they're going to do it again. They're still kind of figuring out what sports they want. So I've done a little bit in the backyard, but not 400 pitches worth yet.
Yeah, we've had some 40-degree practice and game nights, which that really wears on you too.
Yeah.
Gotta be careful. Well, hey, Dr. Bender, thank you for being our guest today. Appreciate your expertise and insight into these things, and hopefully this helps all of us to take care of our patients better. We've got some great topics coming up in the following months to come. We're going to have a really good session with a few coaches to hear their insights and how they approach their athletes and how we can understand their mindset better. We also have a session coming up on heat illness, which is going to be really important just to have some knowledge prior to going into these summer sports as they come online. So again, we love for your feedback on these sessions. Please fill out the evaluations in your email, and we'd be happy to explore other topics that fit your needs. So thanks again, and appreciate you tuning in. Have a good day.